I'm live here in the General Hospital Calabar, and I am here with Dr. Asuko. Today we are finding out more what ectopic pregnancy is, what causes ectopic pregnancy, what are the challenges that comes with ectopic pregnancy, and how to manage an ectopic pregnant patient. So I'm here with Dr. Asuko. Dr. Asuko.
Good afternoon.
Good afternoon, Dr. Asuko.
Hello, sir.
What is ectopic pregnancy, Dr. Asuko?
The ectopic pregnancy, actually, pregnancy in other parts of the body, apart from the uterus, that's the womb where it's supposed to sit. The commonest will be in the fallopian tubes, but it can also be in the abdominal cavity, anywhere in the abdominal cavity. But the commonest, which we'll dwell on today, is usually in the fallopian tube. And it actually occurs when following fertilization, the sperm moves from the vagina through the uterus to the tubes down to where the egg that has been released from the ovary fertilizes the sperm to form what they call a zygote that finally moves down to the womb and grows. At 9 months, the woman delivers. But in a situation where the formed zygote in the tube cannot get to the womb and then it starts growing within the tube. Of course, the tube is not built, does not have the capacity to carry pregnancy. So by the time the pregnancy starts enlarging within the tube, of course, it gets to a point where it gives way and the patient starts bleeding into the peritoneal cavity. And it is this bleeding that causes the pain and the weakness and possibly death that can result from ectopic pregnancy. What can cause ectopic pregnancy? Anything that impedes that movement of that zygote from the tube into the womb can cause. So things like repeated chronic recurrent pelvic inflammatory disease that has affected the tube. When it affects the tube heals by what they call fibrosis. So because of that, movement through the tube down to the womb cannot occur. So the pregnancy gets stuck in the tube and starts growing there, ectopic pregnancy. So repeated infection, that is one. And also repeated surgeries. Someone that has done a lot of surgeries and then because of repeated surgeries, the person tends to heal with a lot of fibrosis. That's bands that can also cause some obstruction to the movement of the zygote down to the womb. And
Okay.
very commonly too, with our young girls doing unprotected intercourse and taking a lot of Postinor 2. Postinor 2 actually causes changes within the tube such that the tube cannot sweep that zygote down to the womb. And because of that, repeatedly, it now causes the pregnant to get stuck in the tube. And that also causes ectopic pregnancy. Those are the commonest causes. How do we prevent it? Prompt and adequate treatment of pelvic inflammatory disease when a woman has pelvic infections. Also, if you know you cannot abstain, why not use protection so that you don't have to keep taking this emergency contraceptive pills, aka Postinor 2, regularly. Yeah? So it's very, very important to make sure you do all this. Young girls, always visit your gynecologist or your family physician, as the case may be, to get treated promptly. Always go for good family planning advice so as to avoid incessant use of these pills, Postinor 2 and all that. And also, please, if you have any form of problems in pregnancy, once you miss your period, make sure you get to the hospital to make sure that one, the pregnancy is in the right place, and then you start your antenatal on time. If God has helped you for the pregnancy to be in the womb, it's very, very important. Thank you very much.
Thank you very much, Dr. Asuko. We
Thank you, sir.
appreciate you coming on to see the program. Thank you, sir.
Thank you very much, sir.
Thank you.
Thank you, sir.